Hello my dears, the topic of today's video is symptoms and methods of diagnosing gallstones. Gallstones can be asymptomatic for years and do not bother the patient in any way, but when symptoms do appear, they can be intense and debilitating. The most common symptoms of gallstones is sudden and severe abdominal pain known as biliary colic, which usually occurs in the upper right side of the abdomen and can go to the back or shoulder. Other symptoms may include nausea, vomiting, abdominal bloating, indigestion, and jaundice, yellowing of the skin and eyes. The average incidence of symptoms in patients with gallstones is about 2% per year. Only 10–20% of asymptomatic patients develop symptoms, and that is 5, 10, or even 20 years after diagnosis. And during this time, the number of stones can increase. They become stronger and larger in size. Before you watch this video further, answer yourself the question: what is the most precious thing in this world? Write in the comments, what do you think is the most precious thing in this world? Our body, God's perfect, ideal, amazing creation. We all have a wonderful opportunity to look inside our body and see how it is working. If there are any irregularities that need correction and immediate intervention, and you don't take advantage of it, you wait for the pain to appear. But a lot of diseases don't hurt, don't show pain, and you wait. During this time, the disease progresses and will manifest itself in the form of complications. Gallstones are often discovered incidentally during an ultrasound or CT scan of the abdomen. Ultrasound is a diagnostic method that uses high-frequency sound, ultrasound waves, to imagine the internal organs of the human body. Ultrasound or ultrasonography has high specificity, 98%, and high sensitivity, 95%, for detecting gallstones. It is an inexpensive, non-invasive diagnostic method and is the study of first choice for detecting gallstones and cholecystitis. Other imaging techniques such as computed tomography (CT), magnetic resonance imaging (MRI), and endoscopic retrograde cholangiopancreatography (ERCP) can be used to further evaluate a person with gallstone disease. Computed tomography (CT) is superior to ultrasonography in visualizing the bile ducts, but its higher cost and radiation exposure make it a second option after ultrasonography. Magnetic resonance cholangiopancreatography is a non-invasive study with high sensitivity and specificity for the detection of gallstones. According to the 2010 American College of Radiology guidelines, MRI is recommended as an adjunctive study if ultrasound doesn't provide a clear diagnosis of acute cholecystitis or gallstones. Endoscopic retrograde cholangiopancreatography (ERCP) is an invasive procedure in which 4% to 10% of patients experience bleeding, acute pancreatitis, acute cholangitis, or perforation. But the advantage of ERCP is that it is both a diagnostic and therapeutic procedure. Studies have shown 94% effectiveness of ERCP in removing gallstones. The procedure also allows for stent placement and biopsy of the affected area of tissue found right during the study. Laboratory tests recommended for patients with suspected gallstone complications include a complete blood count and measurement of hepatic transaminase, total bilirubin, alkaline phosphatase, amylase, and lipase. There are other methods of investigation of gallstones in the gallbladder: laboratory tests of blood, instrumental studies of other organs of the patient with gallstone disease. Indications for one or another procedure is determined by the doctor. If symptoms appear that indicate the presence of gallstones in the gallbladder, it is necessary to consult a doctor to prevent possible complications. Since most people having gallstones and many other diseases are asymptomatic, I recommend that you have a checkup at least once a year, that is an examination of the main indicators of your body's health. To understand the causes of gallstone disease, watch the video about 10 causes and risk factors for gallstones. And in the next video, we will move on to methods of treatment and prevention of gallstones. I wish you health, love, and light. Your Dr. Zarifa Romanova.